It's really scary when your doctor tells you that you need to have a biopsy. Women have this experience a lot. The three most common reasons that a woman needs a biopsy are for an abnormal mammogram, where a breast biopsy is recommended, for an abnormal pap smear, where a cervical biopsy is recommended, or for abnormal bleeding, when an endometrial biopsy or from the inner lining of the uterus is recommended. In the case of these three biopsies, the doctor is trying to rule out cancer. Once I prove that my patient doesn't have cancer, then I can go on to treat the problem. For example, you have abnormal bleeding and you just want the bleeding to stop, but the doctor wants to get a biopsy to make sure you don't have cancer. That is the first step, because before you can treat abnormal bleeding, first you have to make sure that there's nothing more serious going on. As a doctor, I'm always careful to reassure my patient that I'm hoping and praying that it's not cancer, because cancer is such a scary disease. But I have to do that first in order to provide the best care for my patients. So if your doctor recommends a biopsy, don't be too scared. Understand it's the first step your doctor has to do in order to rule out a more serious condition, so your doctor can provide you relief from your symptoms. Make sure you see your doctor regularly, because as physicians, we're trained to detect things before they become serious. So even if we diagnose cancer, we want to diagnose it early so that we're successful in treating it. Take good care of your health, take care of your loved one's health, and find a doctor that you can trust.